Hi, everyone. Welcome to our Module 9 lecture on arousal regulation and imagery. As we've talked about before, when athletes are put in stressful situations, there is a heightened level of arousal. They may be feeling anxious, worried, overcome with emotion, all things that come with a heightened level of arousal. And just like everyone else outside of sport, if athletes don't cope with this amount of stress appropriately, if they don't find a way to bring down their anxiety, whether it's anxiety related to pre-performance or anxiety related during pivotal moments in a game or competition, then of course we start to see a detriment to the performance, self-satisfaction, and ultimately enjoyment that the athletes have in competing in their sport. In order for athletes to regulate their levels of arousal, develop appropriate coping techniques, and decrease their anxiety, they need to be aware of their own level of arousal. If you think back to when we talk about personality, we know that inherently there are some athletes that are much more anxious than others. As you can imagine, these are the athletes that struggle with regulation of arousal. Some arousal is good. As we've talked about before, we want athletes to care, we want athletes to be engaged as to what's going on, but an inability, once again, to control that arousal, to lose control, and to not have a firm grasp of what's going on and let anxiety and feelings of overwhelmingness take over, then we start to see again poor performance, poor enjoyment, and poor self-satisfaction. Something that's really interesting to note, and I have this here for you on the slide. Of course, different athletes come into the picture with different traits of anxiety, and naturally some athletes are more anxious than others. But what does matter more than anything is how those coping mechanisms are. So in other words, there might be an athlete that is naturally more anxious than another athlete, but if he or she becomes much more effective in coping, in developing strong coping mechanisms to lower his or her anxiety, to manage resilience or to be resilient and manage adversity, versus another athlete who may not be as naturally anxious, but gets anxious in the moment of sport and doesn't cope well, then the person who, believe it or not, has more anxiety to begin with, but is better adjusted with their coping mechanisms, that person is more likely to succeed. When athletes encounter anxiety, which again, anxiety is a big factor or I should say a big consequence of heightened arousal states. There are 3 different techniques that we encourage athletes to take advantage of. There are somatic anxiety reduction techniques, there are cognitive anxiety reduction techniques, and even multimodal anxiety reduction packages, which are just combinations of somatic and cognitive techniques. When we think about somatic anxiety reduction techniques, there are really 2 examples that come to mind. Probably the most popular examples include progressive muscle relaxation, which essentially includes having an athlete either lay down, sit down, or be in some sort of relaxed environment in which they can systematically work their way from muscle to muscle, either starting from the top down or going from the down top, meaning the order of their muscles. And all they do is they tense the muscle, maybe they take a deep breath here or there, and then they move on, and then they tense and relax. They tense and relax. The biggest point of somatic anxiety reduction is helping athletes understand what their body looks like in a tense state and helping them understand what they can do so that they no longer have that tense state. A good example often comes up in forms of runners. Think cross country, maybe track and field. Athletes that have a high degree of anxiety, which manifests itself as muscle tension, you can see it on them, right? You might be able to see them running and maybe their shoulders are elevated because their traps are too tight, something along the lines in which their mechanics are not fluid. So that person, those athletes would be good candidates to engage in muscle relaxation, progressive muscle relaxation, in order to cope with that tensing sensation prior to an event, prior to a race. The second technique that's associated with the category of somatic anxiety reduction techniques is breathing. Typically, this is diaphragmatic breathing, which is breathing that really engages your diaphragm. And this is something that, I'm sure you've heard before, that you've done yourself, I'm sure countless of times. essentially breathing in through your nose, breathing out through your mouth, holding in your breath sometimes for a couple seconds to make sure you get all the muscles that help you inhale and exhale, get them to properly expand and relax. And as I kind of just alluded to, it's not uncommon to pair breathing techniques with progressive muscle relaxation techniques. When we move on to our next category of anxiety reducing techniques, we look at cognitive anxiety reduction techniques. A lot of these are just associated with heightened concentration, with trying to elicit some sort of response in your head when you have negative thoughts, right? You might have heard of thought stoppage, positive thinking, positive thoughts, positive affirmations, telling yourself not to worry, telling yourself that you will overcome the anxiety, that you will succeed. And then going into our third category, multimodal anxiety reduction techniques, here we start to combine through different techniques, different structures, I should say, guidelines that are out there. And your text goes into a couple of these. So, watch out for those when you read the chapter, or the chapters, I should say, associated with this module. Combination of doing things to help relax your body, hence somatic anxiety, and doing things to help relax your mind, hence cognitive anxiety. So as this anxiety builds and this level of arousal builds with the anxiety increasing, and we expect athletes to hopefully cope well, it's important to understand coping. We define coping as a process of constant changing cognitive behavioral efforts to manage specific external or internal demands or conflicts as taxing or exceeding one's resources. So someone has to cope when they're encountered with a situation that naturally may not occur, or a situation that, again, puts them in a heightened level of arousal, and they have to rely on some of those anxiety lowering techniques to decrease their level of arousal. Athletes use a broad spectrum of coping techniques. It's almost rare to hear of an athlete that uses one or two coping techniques only and for all types of scenarios. It's more common to have athletes that use multiple coping techniques and athletes that diversify their coping techniques based on the situations that occur. We classify coping techniques into really two types of coping based on, obviously, the problems that lead to the coping. We have problem-focused coping, and we also have emotion-focused coping. When we talk about problem-focused coping, we're talking about efforts to alter or manage the problems that are causing stress. So trying to find a problem that's leading to the stress, trying to solve that situation. We may use time management skills, problem-solving skills, something that we can identify as the problem at hand, and we're doing what we can to make sure that we alleviate that problem. Emotion-focused coping, this is essentially the emotional response to the problem. So in other words, this is when the problem bleeds into how you feel about the problem and causes yet another sort of coping to take place. So what you start to see is when athletes focus on a problem and they become very stressed over not being able to solve the problem. And again, the problem could be related to sport or something else. Then they get very emotionally distressed. And then obviously, instead of just problem-focused coping techniques, they have to become much more dependent on emotion-focused coping techniques as well. So let's talk about some of these specific techniques that athletes use. So there's a couple of these. So I'm going to run through them pretty quickly. And I've mentioned some of these already. Athletes can control their thoughts. They can ignore distractions. So perhaps if they, think about professional sports, an athlete in an away game, they have the crowd yelling at them. If that's the case, maybe they ignore what the crowd is saying. If they themselves start having internal doubt about things they cannot do or performances they cannot accomplish, they stop those thoughts in their track. That's known as thought stoppage. Task focus or narrowing, maybe not worrying about the outcome of a game or competition, but just focusing on an individual play, on individual skill. You see this a lot in free throws in basketball, or maybe penalty kicks or free kicks in different other sports. Rational thinking, self-talk, actually outwardly saying the things you want to accomplish. Positive focus and orientation, right? Thinking positively, not thinking if we don't score here, we're probably going to lose, or if this play doesn't happen, then we probably will go down in the second half, not having those thoughts. And of course, that ties into a little bit of thought control as well. We also have social support, which comes up a lot when players are trying to rely on other players, athletes trying to rely on other athletes, and coaches are being also the social support. That comes up a lot in social support. Pre-competitive mental preparation, time management, training hard and smart. Of course, that kind of goes with being prepared, and that's a coping technique that I think uh, is one that translates very well off outside of sports as well. Think about yourself going into an interview. If you're someone that gets nervous during an interview, then one of the best things you could probably do is, of course, prepare as best you can, because the more prepared you are, the better you'll be able to cope with maybe any questions that are given to you during an interview. Couple conclusions that we've reached as part of our understanding and coping. As I said earlier, there's not one single coping strategy that works for everybody, works in all situations. Problem and emotion focused coping strategies are ones that are used I don't want to say interchangeably, but ones that are used often at the same time, or are quickly switched back and forth between the scenario. And that's because obviously athletes are put in all types, just like everyone else, athletes are put in all types of situations, and they have to deal with stress from all different types of sources. Things like gender, age, puberty status, maturity level can affect types of coping strategies that are used and how effective they are. Most often, coping is situation specific more than problem specific. And although there are a lot of differences in how athletes cope, ultimately, as athletes try to find the best situations for them, many times you start seeing a trial and error approach where they try one thing, doesn't really work that well. Maybe they try something else, a combination of a couple of things. And that's going back to what we said earlier in the semester. We discussed the importance of understanding how psychological skills training is a process and not something that can be done in just a day or a week. Same thing here. If a coping strategy doesn't work, you just keep trying until you find the right one, or maybe you try it a couple of times, maybe you tweak a couple things. If something doesn't work once, you can't just give up on it. You got to put a little bit of effort in. And athletes need to know that when they're trying to find specific coping strategies for themselves. So second part of this presentation, we're going to get into imagery. Imagery is something that athletes can use as part of their psychological skills training. And as you would expect, we just finished talking about coping. Imagery can be a great tool in which athletes use imagery to help them cope with certain situations, help them build their psychological resiliency. Depending on what text you're reading, depending on what resource you look at, imagery has also been called visualization, mental rehearsal, symbolic rehearsal, covert practice, mental practice. For our purposes, we'll say that they all really mean the same thing. Imagery essentially is the creating or recreating of an experience in your mind. Imagery involves all the senses: visual, kinesthetic, auditory, tactile, olfactory. So some people say when they develop some sort of experience in their mind, they can smell something, they feel the texture on their fingertips, they can hear a sound, they could see something. That's all imagery. Don't think of imagery just something that you see. Imagery, especially when it's done really well, encompasses all of the body senses. With imagery, there has to be a previous experience that existed for the athlete to make sense. Particularly with athletes, we know that athletes naturally are kinesthetic creatures. What that means is that they like to do things with their hands and feet. They like to move. They like to have awareness of their body in space. So some of the best things they can experience are probably things within that sport, or things within practice, or things that they've done before that relate perhaps to the activity that they're doing. Perhaps they, and we're going to get into some specific examples just a short while, but perhaps they relate experiences to experiences in which they were very, very successful. So in other words, maybe when they're having a bad game, bad player, they're having a rough time during a situation, they rely on using positive imagery from things that they've done successfully and positively in the past. And because this is such a simulated experience with all these different senses, you can imagine that there's multiple emotions and moods that go into using imagery. So when an athlete uses imagery, there are really 5 things to think about. These 5 things are known as the 5 characteristics of the imagery process. We have modality, perspective, angle, agency, deliberation. Modality, we kind of touched upon this a little bit. What senses are being used? Is it something that they hear? Is it something that they see? Something that they can feel? Something that they can move with kinesthetic types of feelings? Is it something they could potentially smell? Is the perspective themselves? Are they imagining their point of view or someone else? Or maybe it's a coach's point of view. That's a common imagery process as well. What's the viewing angle? Is it top down, or is it first? Is it more along the lines of, are they able to see through certain things? Are they looking on the reverse side of something? What's going on? Where are they in their experience? And again, doesn't I know I keep saying see, but it could be smell, could be feel, could be any other modality. What is the behavior that's being imagined? Does it come from themselves? Is it something they did, or are they perhaps putting themselves in the body of a professional athlete, or they're thinking about what would this person do, or they're having an imagery of this person, maybe someone they look up to, maybe someone on their team who they have a great relationship with. And ultimately, in deliberation, the degree to which imagery is deliberate or spontaneous, triggered. So does the athlete have to stop themselves and think, okay, now I have to think about this. Now I have to smell this. Now I have to feel this. Or does it just naturally happen? And again, like we talked about when we reviewed the introduction to psychological skills training, remember that going through the process of learning, for athletes to learn those skills, and imagery is one of those skills, there has to be an education phase, acquisition phase, and a practice phase. When it's more deliberate, it's of course more so in the education phase. The athletes are learning about what to do, what to think in their heads in order to make the imagery happen. Acquisition, it's getting tailored, working with the coach or the sports psychologist. But as the athlete progresses to using imagery in the practice phase, becomes much more spontaneous. Maybe there's something that just happens in the course of a game or practice that triggers that event. So very quickly here, we have another short video from Dr. Robin Veely, and what she's going to do, and just bear with me here, she's going to quickly just give her interpretation of what imagery is and how it can be used. So let's go ahead and check this out.
Imagery is using all of one's senses to create or recreate a situation. That's the way I explain it to athletes. So there's a couple things that are important about that definition. One is the senses. So you don't have to use all your senses, but it's nice to use multiple senses, like feeling, kinesthetic, visual, hearing, tactile, touch. So it's sensory, meaning that you're not actually doing it, you're thinking about doing it. And the other part of that definition that I think is important is that you can use imagery to create a situation like, how am I going to respond to this situation in competition? How am I going to feel when I get up to serve the first serve in a volleyball match? Or to recreate. So I recreate exceptional performances, times when I've been mentally tough, to replay that to kind of make myself feel confident and prepared. Imagery works because imagery works in the brain. We use the term muscle memory, but Bob Rotella, one of my favorite sports psych guys, always likes to say there's no such thing as a muscle memory. And what he means is that imagery really happens in your brain, but your brain controls your muscles. So by using imagery, what you're doing in your brain is if you have like a mental blueprint of skill, it's like you're rehearsing it, and you're grooving that blueprint to be more efficient, to be more perfect in your response. So it's just like, in many ways, it's like physically taking 50 free throws. By mentally doing it, your brain to some degree doesn't know the difference. And so your brain is grooving that same shot over and over in your head to be perfect.
great points there, especially like the point that was made about building that blueprint, right? Using imagery, ideally multiple senses within the imagery to not just determine what you may do in future performances, but also if you're struggling, how to use imagery on the spot to maybe relay back to a recreation of a really good performance. So again, hopefully that really drove the point home of exactly what imagery is. So let's go back here. So based on now what we know about imagery, it's no surprise that we can use imagery to do things such as improve motivation and concentration, build confidence, control emotional responses, right? Predict future emotional responses as well. Enhance sports skills, kind of hash out maybe some fundamental flaws. You see this a lot in the NBA where players are struggling with free throws. So, it's not impossible to think that their issues aren't necessarily only physically and technically related, but maybe they have some sort of issue with performance and arousal and anxiety or lack of anxiety coping mechanisms when it comes to that skill. And maybe they're poor at shooting free throws. You can acquire, practice different strategies, can help you prepare for competition, cope with pain, adversity, solve different types of problems. What I like about this figure here that comes from your text, it gives you different types of images that could be constructed in someone's mind. There can be goal-oriented responses. Someone can imagine themselves, winning a particular event, winning a medal. There can be completion of skills, specific skills. The example you see here is obviously imagining performing the parallel bar successfully, imagine sinking the free throw. General imaging, just to kind of relax the body, again, to bring down that state of arousal. That can include just being by a quiet place, imagining yourself being somewhere where you're comfortable. Or it can be more specific to a strategy, or maybe generalized to a broad strategy that you can use that can help you, execute that same strategy to beat a certain opponent, beat a certain team. With imagery, there's 5 theories that have really gotten popular, kind of to explain, and they touched the video that we watched touched upon this a little bit in terms of exactly how these theories came to be. I remember what theories are. Theories are essentially what we think is how it works. So none of these necessarily the be all end all, but these are essentially quick theories that seek to explain how that process works, why it's so effective. So we have the psychoneuromuscular theory, the symbolic learning theory, the bioinformational theory, triple code model, and various psychological explanations. In the psychoneuromuscular theory, this kind of goes with what we heard in the video, where you don't necessarily have muscle memory. What you really have are actions that you do that your brain picks up on. And the more often that you do those actions or think about those actions, the more effective your brain becomes in doing those actions. And I think if you think back to the video, what was said is whether you're shooting 50 free throws or imagining your 50 free throws, your brain may not know all the difference. And that saying more or less comes from this theory. We have the symbolic learning theory where imagery helps us pretty much develop better of a blueprint, better of an understanding of how we are going to move. So now thinking back to the free throw example, it's not so much that the muscles or the brain doesn't know the difference between whether or not you're actually shooting free throws or you're just pretending or imagining you're shooting free throws. But now by you thinking the process, you think things such as, I have my feet squared up, I bend my knees a certain way, I'm holding the ball a certain way, I'm looking at a certain place. By thinking that through, the blueprint is set in the ground. So by the time your body goes to do it, it feels a little bit more comfortable. It has those symbols in terms of the cues that it needs from a technical standpoint. The bioinformational theory, this one talks about stimulus and response propositions, where it's important to sync the response, or I should say it's important to sync the stimulus to the response. In other words, it's important to sync, okay, this is how I need to move my stimulus in order to get my response that I want, whether it is to make that free throw, which is obviously a positive response, or miss the free throw, which is the negative response. And this is more along the lines of a cause and effect type of scenario. Triple code model. This breaks imagery down into image, somatic response, and meaning of the image. So that just means that something takes place in the mind of the individual, the image. The body reacts in a certain way. There's a somatic response, and then the brain interprets that image. And lastly, there are just some general psychological explanations that get grouped into a final theory. I'll just go through these pretty quickly. Imagery develops mental skills. I think we can all agree upon that, because imagery does take work. You do have to concentrate. You do have to have confidence in yourself, even if it's in your head, maybe to see yourself be successful and do successful things. That's going to naturally reduce some anxiety. Imagery essentially helps to set the right level of arousal, because again, some arousal is good, but when arousal is heightened to the point that coping mechanisms can't maintain, that's no good. And then lastly, we also have some suggestions and some findings that imagery enhances feelings of confidence, again, reduce anxiety levels, increases concentration. Pretty much what I just said, in a different way to say it, but essentially different explanations here from a more psychological standpoint. Another video here. I don't think we're going to watch this one. Again, just different ways to continue to use imagery. But ultimately, what we do find is, and we saw this in the first video, is be able to incorporate as many senses as you can, right? Maybe someone is playing in a football game and they're really nervous before a game, so they want to use imagery to calm themselves down. So maybe their technique is to imagine themselves a year previous where they had a really great performance, and they imagine themselves how they felt that day when they played really well. So they think about what they saw that day, what they felt that day. Maybe they can smell the grass. They can hear people in the stands right before the kickoff. So again, they're incorporating more senses. Perhaps they're also able to take that feeling and maybe move that visual throughout different parts of the scenario. So they're thinking about the image at that point in time. Then as it progresses, maybe they're thinking about the image at another point in time. Thinking about being able to control things. That came back to the figure I showed you earlier with thinking of strategies, thinking of succeeding at a particular skill, being able to determine the direction in which the image will go. In exercise, which of course is tied in very closely to sport, and another premise of our course here, imagery is very good to help improve technique. Aerobics research has found that imagery helps develop routines better, more effectively. Also, going back to exercise, we know that imagery helps to create better environments, more comfortable environments. I've worked with some high school students who, have expressed interest in getting more comfortable with exercising. And maybe in the beginning, they had some intimidation about going to the gym because they didn't want to be stared at, or they want to feel uncomfortable. So, as they, would maybe do some exercises in private, they would find ways to see how they would feel or work in imagery of them exercising, them following technique in a more public place. That's an example in which someone who wants to get into exercise would use imagery to be able to succeed. A couple other important uses I just want to go through here. Competitive outcomes, images of doing well. Fitness and health outcomes, images related to improvements in fitness and health. So someone sees themselves running a marathon. They see themselves being able to lift a certain amount of weight, not having to take a certain medication. Emotions and feelings associated with imagery. There's images that can make people feel more excited, more aroused, but at the same time, there's also images that can reduce stress. So understanding, given the situation, when to use which image, because it would make no sense to use an image that isn't appropriate for a particular time. And exercise self-efficacy images that improve confidence and provide confidence to sustain workouts. In the text, we see something known as the PETLEP model of imagery. This is essentially a model, an acronym that's used often to help individuals understand what type of imagery they should use and how they should use it. PETLEP stands for physical, environment, task, timing, learning, emotion, perspective, and then they figure out each of those elements for the image that they want to use, and that helps them determine the type of imagery that they should be trying to recreate in their mind. Like we talked about in the psychological skills training content, just like physical training, psychological training has repetitions too, has certain variables associated with it. So the recommendation with imagery training is typically 3 to 4 sessions a week. Sessions typically range between 15 and 30 minutes. Number of repetitions obviously varies with the length of the sports skill, particularly if someone has a very long imagery process in their head of an event that took a period of time. But even if it's a few times run over, the image that's recreated should be recreated at least a couple times during each experience. And best times to use imagery, I mean, there's really a lot of times to use imagery. Before and after practice, before and after competition, the off season, we saw that come up again when we talked about the best time to implement a psychological skills training program during breaks in action, practice, competition, breaks in that type of action, personal time, recovering from an injury. That's huge. Something that I'm interested in and something that I plan on continuing to do research in is really rehabilitation psychology. So essentially, one of the things they could do as part of that is imagery during rehabilitation. So understanding how they can do exercises while they are manifesting an image during a game, or an image that comes from a game or recreation of a previous experience. General recommendations for imagery use. Like other types of psychological skills, all ages can benefit from imagery training. Athletes of all skills can use imagery. Images obviously should elicit positive responses, not negative. Imagery should be used really, as much as possible, particularly when there's no need or no time for physical activity, especially. So what that means is, if someone has time off from the physical side of the skills and they continue to train through imagery, that means they continue to stay wired in terms of the skills that are expected of them. And then just as a rule of thumb, you want people to be in a generally good mood. You don't want people to, be very sad or be naturally, not calm when they try to create imagery. Hence why you're trying to use this during times where it's not of true physical exertion. Because if someone's in a bad mood, they try to create images, they're naturally going to create more negative images than positive, and that defeats the purpose. And that is it.